A very good evening. You're watching the India Development Debate with me, Tamanna Inamdar, and what a news day it has been. Let me just quickly tell you what's lined up on the show before we crack on. First up, we're going to be talking about India's COVID situation. We're nearing on 8 lakh cases. We're number 3 in the world, and the government says there are no signs of community transmission as of yet. So what really is going on? A deep dive on that coming up next. Also, COVID related in a sense is a look at what's happening with the restaurant business in India. Now, there was a buzz today after the UK has decided to subsidize people to go out and spend money in restaurants. What can be done for the Indian restaurant business? How many restaurants are actually going to survive? We're going to be looking at that story. Of course, the fascinating and crazy story of UP gangster Vikas Dubey, who finally got arrested today after a 7-day nationwide manhunt and the entire tale that followed. We're also, of course, going to be looking at why retail investors are suddenly back in the market in such large numbers and whether it's a good idea. So I have a lot lined up for you this evening. Let's begin though with the question of COVID-19. Now, India is nearing on nearly 8 lakh cases. We have added more than 25,000 cases a day today for the first time. So we've crossed that 25K mark. We're the third highest in number ahead of Russia, and the government right now says no community transmission. The question is, how close are we to really flattening this curve? To speak on this with me, I'm joined now by Dr. Ramanan Laxminarayan, Director of the Center for Disease Dynamics, Economic and Policy, with us on the show this evening. Also, Dhrubabrata Ghosh Dastidar, Director, Data and Analytics at Protiviti, India. Dhrubo, let me come to you on where you see the numbers going. You've been tracking, Protiviti has been tracking the numbers very closely all through this time. We're close to 8 lakh cases now. What is the data telling you?
What we have seen, Tamanna, over the last few weeks is there is a surge in the number of cases, which translates that we are going to see a much more higher peak than we were estimating before. The epicenter, which was previously Maharashtra or Delhi, perhaps is moving towards the southern states. So we are looking at a much higher number than before. And the epicenter perhaps now will be Karnataka and Telangana, which has seen a huge increase in the number of cases because of this unlocking. And we will continue to see that rise. It will be very interesting, or rather we have to cautiously monitor which are the other cities or states which are spiking up or becoming the epicenter as we move on. Definitely what we have seen is Karnataka is registering around 2,500 cases on a daily basis now. So that's something we have to be worried about. What we have seen in Bombay and other places, it started to go down, which means that it's a positive sign for Mumbai at least. However, for Maharashtra, it's still a cause of concern because Thane, Pune, it's still on the rise. So definitely there are a few epicenters right now within India which is causing concern, and we have to kind of monitor it on an ongoing basis.
Dhruba, give me a sense about, your take on community transmission. Now, community transmission, very simply put, is when you cannot any longer identify the source. Now, in most countries, community transmission is at stage 3. They have been seeing community transmission. How do you define it in the Indian context?
I mean that we are at a very high number, right? And we are growing. So it is very likely that we might be in community transmission, but at the same time, we are a very populous country, right? So if we are in community transmission, are we looking at maybe 1 lakh cases a day? That's something it's very difficult to say from the data itself. It's something on the ground through testing, through sources or through reports can only ascertain that. looking at data, I don't think it's possible for me to give you a concrete answer. But yes, the numbers are rising. It's a cause of concern, and definitely there may be some amount of community transmission in certain states or even cities, or maybe localities. So it's very difficult just from data to kind of uh, put a right answer or a concrete answer to that.
Okay, Dr. Ramanan is with us now. We briefly lost the line with him earlier. Dr. Ramanan, great to have you on this show again, and in all of these times when we are grappling with connecting over technology. But just your take on community transmission and where India is at. I mean, we're revisiting COVID and the progress of the disease after some time on the show, and we're nearing 8 lakh cases now. Can we even see to the stage when we start flattening the curve?
So, there is no actual definition per se of community transmission. In colloquial language, it would be either you got the case from outside the country or you got it from someone within the country. We know that flights stopped coming, months ago from outside the country. So any case you get, you must have had inside the country. But it's clear that this is a subject where, people, it's a definitional thing. It's not worth wasting any more airtime on whether it's community transmission or not. The truth is that you are likely to get COVID in India, and you will never know who you actually got it from, and that's just the fact of the matter. Now, I think as we've discussed before as well, it is still too early to think of flattening a curve in India for two reasons. One is just from a sheer carrying capacity, the potential for the numbers of cases. The reason why we predicted the large number of cases eventually in India is because India doesn't have the ability to control COVID in the same way that, Singapore or South Korea would. But India also has a large population, which means that at the carrying capacity, that's not going to cap out at 500,000 or a million people. That's going to cap out at, a very large number, millions of cases. We also know that the current number of cases is only a small fraction of the real numbers of cases. What we have are reported cases. Now, we have to remember that India is on the list of countries on testing per capita. We are number 138th. I think, some other countries in the region are in that range, below 138. Most countries test far more per capita than we do. So it should be no surprise that we undercount a lot of cases, we undercount a lot of deaths. So let's not refer to this 800,000 number as cases. It's 800,000 is the reported cases. And you don't have to go far. You have to go see how difficult it is to go get an RT-PCR test done, even if you had symptoms today. They'll ask you to come back after 2 days. And even after then, it will be very difficult. And then, of course, 2,400 rupees is an expensive proposition for most Indians. So I think it's a challenge that we have not yet set out ways to overcome. So until then, we will still see cases rising, but we only have an incomplete handle on the epidemic. And I don't think we are. I don't think we've seen the end of it, and we won't see the end of it for a while.
Yeah. Now, so Dr. Ramanan, in terms of testing, now the government says that testing has been increasing consistently in hotspots like Delhi and in Mumbai. Mumbai recently they removed the requirement of a doctor's prescription for a test. These antigen tests have been put in place. Community testing has been taking place. So, do you think that the efforts being made to ramp up testing are sufficient?
I think efforts are being made to ramp up testing. So let's be very clear. And there are parts of India that I have to say are testing at levels that even high income countries are coming close to. So it is not like it's a national problem. It's a very much of some states have that problem. So if you take Tamil Nadu or Andhra Pradesh, they are testing almost as many people per million population as a country as the US is. Not far behind, and especially considering how poor they are compared to the per capita income of the United States. But that said, and this is something to appreciate, which is COVID testing is not a perfect thing. You have sort of these three tests. In the first 7 days, we've got this RT-PCR test. It is only about 70% sensitive. If you take that antigen test that is now being handed out widely, that's only about 60% sensitive. And we are told that when it's very hot, under heat conditions, the sensitivity goes down to 50%. Sensitivity means that you only have a 50% chance of detecting a case, even if that person really has COVID. And after the first 8 or 9 days, both these tests are not useful, and then you have moved to an antibody test. So it's a function of the fact that testing itself is not this perfect, it's not like finding your weight on a weighing scale where you can get it reasonably accurate. This itself is a challenging proposition. And then on top of it, what we're trying to do is, in a very densely populated country, we are obviously trying to design public health measures around the information from the testing. And you have to remember, today we might be doing, probably close to 240,000 tests a day. But in March, we were doing only 3,000 tests a day. So I don't doubt the effort. A lot has gone into increasing testing, but the fact remains that we're a large country, and 240,000 tests a day is literally, it's a drop in the bucket. And for a country in which there's a raging epidemic, it is hardly enough. So, we can't go back in time and improve our lab facilities, which is what we should have done before the pandemic. We can't go back in time and improve our public health facilities before the pandemic. So I think we should fight this with the tools that we have, and not not worry too much about the fact that we haven't done everything that we possibly should have. At least we're trying to do everything that we can at the moment.
Yeah, no, there is a marked improvement in the kind of focus on testing. At the very least, we can give credit where it's due. Dhrubu, I want to come on, to you on another aspect. Now, today in the Health Ministry briefing, the message put out there was that about 8 states account for 90% of the active coronavirus cases. We've done away with the green, orange, and red demarcation which we had seen during the first few phases of lockdown. But having said that, do you think it's safe to say that we've managed to contain the disease to certain areas? Because if you remember, the fear was that migrant workers going back home might actually hasten the spread of coronavirus across the country.
I wouldn't be so sure, right? We are saying that the 9 states or 9 districts kind of are the higher number of cases. But if you look at Karnataka or Telangana, 15 days back or a month back, they wouldn't be on the list, right? So it is a constantly evolving situation, and states which was not predominantly contributing to this are now becoming the highest contributors on this huge number of cases. So we should need to keep an eye as to where these states are, and if there are early warning signals, how we can tackle those cases. And if you look at a comparison between right now what Gujarat or Madhya Pradesh, Rajasthan is, some of the southern states like Kerala, Tamil Nadu, Karnataka, Andhra Pradesh were in the same league. Now the tables has just turned. So I would be cautious. The places where the cases have been coming down or the R0 is going down, we shouldn't start celebrating and start opening up everything. We should be cautious so that we do not go back into the same red zone in due course of time. And we should keep an eye on the states which are starting to show signs. If you look at Bihar, West Bengal, and even Orissa, there are numbers increasing on a day-to-day basis, which means if we are not careful enough, we might end up in a similar situation as we had with Bombay or Delhi sometime back.
Yeah, it's. I don't think it's about celebrating and opening up. It's about not having a clear indication of when is it okay to open up, and that's actually what I wanted to come to Dr. Ramanan next on. We have seen signs of opening up. Hotels have been allowed to open up. Most businesses, manufacturing plants are opening up, and they're figuring out how to work even with COVID cases coming through. Now, there seems to be no benchmark one can hit on when is it okay to open up in the next step. it seems to be driven by a necessity to keep an economy running so that, the harm done by a lack of livelihood doesn't outweigh that done by the coronavirus. Do you think that's the right approach right now? Just learn to live with it till a vaccine comes around.
For India, where lockdowns are less effective than in other countries, even if they're harsh, and lockdowns are also extremely difficult in terms of the economic costs that they impose, the economy has to come back. People have to make a living, and we can't always choose to, just work from or just be in the, hidden away. I think some have suggested a reverse quarantine, which we've been talking about for a very long time, which is let us focus our attention of testing and of preventing cases and deaths amongst the elderly, especially those above the age of 60, but certainly even above the age of 50, because that's the high-risk population. Let's focus on mortality reductions. Getting COVID itself is not a kiss of death. This is not going to affect most people. And some of the the spin that is put on these numbers, I find a bit challenging, because when I see the number which says 60% or 65% of people have recovered from COVID, these are meaningless numbers. 99+% of people will recover from COVID. So we know that is the case. You also see some of these numbers which say most cases in just 6 states. And that, again, as was just pointed out, just doesn't make any sense. You're always going to have most cases in some 6 states. That 6 states is going to keep changing over time. So let's stop with the spin and let's focus on real solutions. A real solution is, let us prioritize economic activity when the economic gain from the activity in terms of livelihoods is significant, but we're taking a calculated risk with respect to the virus, which is why there is probably a ban on weddings and mass gatherings and election rallies and religious gatherings and so forth, because the economic gain in terms of livelihoods is not that important. But the cost in terms of people getting the disease and spreading it further is significant. And by the same token, there might be things which do encourage the spread of the virus. For instance, if people were to go on suburban trains or to go, public transportation to get to work, there is a risk of COVID. But these are calculated risks which are meaningful to take on because there is a commensurate benefit. And I think as a society, we've got to say, look, there is a risk-benefit calculus, and if the risk is maybe high everywhere, but let's do the ones where the benefit is also quite high. And that's what the criteria should be for opening up. And the last thing I'd want to say is that I guess the population has gotten used to some extent with the sudden lockdowns and the sudden lifting up and so forth. But that's not great from an economic standpoint either. The thing that brings back economies is a certain bit of certainty. Uncertainty is always a bad thing from an economic perspective. And I think that setting the rules out in advance so that people know what to expect and not shutting things down suddenly, having a curfew for 1 month, these all are a killer for small businesses, for shopkeepers, and just day laborers, people having to earn a living. They can't plan around it. So I think this sudden movement kind of a strategy in March that was reasonable because we didn't have data, but today we have enough data to do a very rational plan for what's going to happen, and I think we should be a much more data-guided approach.
Well, we seem to be getting there. We seem to be getting there at least. And, the numbers do keep surging. They may be even larger, as Dr. Ramanan has pointed out. We just have to go back to the basics of testing, contact tracing and isolation. There's really no shortcut here. Thank you so much, Dr. Ramanan and Dhrubo, for joining us on the first discussion this evening.